what we plan to do is not to rehash a number of the topics we spoke about at the Hobart conference, which we were very lucky to attend. It was a fantastic conference, a lot of great material, but to give an overall summary of some of the reasons behind why epidemic and pandemic risks are increasing, but at the same time, really provide an update about the solution we've crafted specifically for Unimutual's members, such as yourself attending the call today, with the feedback we received, not just from the actual Hobart, Unimutual event, but also the subsequent surveys which we received, and we'll address some of these topics then. And then hopefully we'll have a little bit of Q&A, but of course, if the questions you may have, you may not wish to raise today, by all means, reach out to Unimutual contact ourselves, and we'll be very happy to answer them later on as well. So with that, I might just jump in. So just a quick, broad summary of where we are right now. So just to inform the audience again, our team of experts comprises not just of your standard underwriting, teams, which you will find at various different insurance companies here in both Australia and overseas, but we also have a number of epidemiologists on our staff. A lot of them come from public sector. A lot of them also work with universities in Europe. And for us, our team was actually developed before COVID-19, which I think is a very important topic just to raise, because we're not a knee-jerk reaction. We've been around since 2017 and have a plethora of information, and this is how we are able to price this risk and provide this risk to the market. Whereas you may hear many of your other insurance parties, they say, well, pandemic risk is uninsurable, but we certainly beg to differ, and we'll explain a little bit more about how we bring capacity to the market as well. Now, won't go through COVID-19. We all know, we've all experienced around the world, different levels of losses, whether that's tangible losses, whether that's intangible losses as reputation, but there are a number of different ways that COVID-19 affected the community. And putting all this together in one methodology for us to bring a product to the market. Of course, there's many different ways, but we found, based on the survey results, based on our interaction with members, based on our interaction with Unimutual, that we'll focus on two different types of coverage that we'll offer for your renewal end of this year. The first being a base plan, which is tailored exclusively to cover extra expenses at a very good price point. And by good, I mean a very inexpensive price point, just to understand how this product works. But on the flip side, we also receive quite a bit of requests from your members about how we can not only increase this base plan in terms of limit and so forth, but also customize this plan so that it can include, for example, have a larger deductible. For example, it can include coverage for overseas campuses. For example, it can take care of staff as well. So pretty much in a nutshell, these are the types of, this is what we'll talk about today. And with that, we wanted to launch very quickly into a video. Now, unfortunately, the limitations of technology are such that we can't show this video. It will be sent around to this group and those others who signed up and unfortunately cannot attend today. But there's a professor who works at Sydney University by the name of, Professor Eddie. Technology is not working so well here. Professor who works at the University of Sydney, who's also very well integrated into the world of virology, both in Australia as well as the UK. He makes a very strong link, and we'll share this video. It's freely available on YouTube, actually, via the Australian Academy of Science, with relation to climate change and the increasing pandemic risk. I don't want to talk too much to this slide, but summarize some of the points on the following slide, which are, there's many, not only does Eddie, I guess, put together the link between pandemic risk and climate change, but there's a lot of other agencies out there, modelers, who predict the probability anywhere up to 3% on any given year for the next pandemic. And towards the end of the slide, we'll also touch upon the recent monkeypox FIC, so the Public Health Emergency of International Concern, what that means, how that interacts with the policy, and some of the other diseases out in the public out there right now, which can have an impact. And also the new UK risk register. This is a slide we showed during Hobart as well, but also provides a longer time horizon of 5 years with up to 25% likelihood. I won't go through the rest of the slide because we spoke towards this in quite some detail. Suffice to say that there have been 3 significant coronaviruses that have happened, SARS, MERS, and COVID-19, as you can see on the slide, over the last 17 years, that has caused much disruption, much change to people's livelihoods. And unfortunately, this frequency and severity of disease is only going to increase. And if you look at the 17 years before this, the 34 years before that, they were not any significant outbreaks of coronavirus that we see right now. So that's really just a high level recap, per se, of the exposure that we're dealing with. Now, I mentioned this earlier, but a lot of insurers in the market, because they haven't put together a way of handling this risk, just exclude this altogether. And what you may hear as well is that this risk is uninsurable, and we don't believe that. We have the data behind that that supports how we can bring this capacity to the market. And let us now share a little bit of the 2 solutions that I mentioned earlier, the base plan as well as the customized version of what it is that you can buy at this renewal to protect yourself. So in a nutshell, this is the base plan. So the base plan is $100,000 limit for extra expenses at a very at a price of $5,750 plus charges and whatnot. Now, we call this the base plan because although it's very broad in terms of covering any type of extra expenses that you might incur to keep your business afloat, the price point, Uni Mutual has really beaten this down to provide as good a premium as we can put together. So how do we get to this point where we're offering 2 plans, the base plan and a customized plan? Well, they're not only from the Hobart, I guess, your conference that we went to, but there've been a series of surveys that have come out after that. The results of the survey, which I will give you a quick update on, were that most respondents wanted some sort of protection against the next pandemic, whether that be a base plan, which is what I mentioned just now. This would provide a rapid cash disbursement for anything or any types of expenses necessary to keep the business running, to the customized plan. So the next 2 boxes will be just a really simple summary of how these 2 can be put together. So the base plan is that Uni Mutual will send their standard quotes, before renewal time, with an option to purchase this base plan. All buyers need to do is to respond positively to Uni Mutual. There's no other data required, no other information, no other proposal forms. We're very comfortable with the type of information that we've seen that Uni Mutual typically requests, whether this be casualty program, property program, or whatnot, but we're comfortable with the information captured there already to provide this base plan. Now, secondly, for the customized plan, a number of respondents have said, well, base plan is great and we want that, but we also want a little bit more. And what is this a little bit more? Well, it could range, as you can see here, at anything from gross profit coverage, it can cover staff costs, it can cover overseas, businesses that you may have, because this plan is strictly Australian plan, or the base plan is strictly Australian coverage. But it can also include business continuity and crisis management assistance that we have with International SOS, or we partnered with International SOS to provide. Now, many of you may consider, oh, we already have a relationship with International SOS. That is great, but the service that we're partnering with them is very different to some of their traditional business. And we've already arranged, I guess you could call it cheaper rates to use International SOS, and much of it is already included in the cover that you'll purchase if you choose a customized option. Now, for this option, this will require a little bit more underwriting, a little bit more information from each prospective buyer. So what we would suggest and what we talk to Union Mutual is to contact Celinda or another Union Mutual representative, but she will put you into contact with us, and we're happy to go through the underwriting process with you to determine what types of limits you may wish to buy, whether an excess attachment point applies, different campuses and whatnot. So it's very customized, very bespoke. We do this in various jurisdictions, including Australia and overseas, and we're happy to also guide you through this process as well. So with that, maybe we now turn a little bit more to how does it actually work? What are the triggers? How will you get paid? How quickly will you get paid? What can you use this money for? So what we term as parametric is, very simply put, is using a third-party reliable index with which to understand if the policy has been triggered or not. So as we all saw during COVID, there was a lot of, I guess for lack of a better word, argy-bargy about whether something is covered, whether it's excluded, but we try to take all of that away. And we try to take that all of it away in a way that it can be paid out very quickly. So what are these three triggers? And I will also talk a little bit more about each of these triggers to provide a little bit more comfort of why we've selected them and how they will work using COVID as an example. These two triggers and the third one, which is pinned to Australia. So the first one we use is the WHO Dawn Disease Outbreak News. There are about 100 of these per year, and what they simply say is, please world, watch out for this outbreak. It may turn to something more serious or sinister. Trigger two is what we call the Public Health Emergency of International Concern, or FIKE. The recent FIKE for monkeypox 2 basically came out as an example. Of course, we'll talk a little bit more about what these are, but this signifies to the world that this disease needs to be taken very seriously, as it could turn into the next pandemic, or it's on its way to coming to or becoming the next pandemic. Trigger three is a civil authority restriction somewhere in Australia. Now, we get asked all the time, but what happens if Victoria, as an example, is locked down and Queensland, as an example, is not locked down? Our trigger number three, any civil authority restriction in any part of Australia already opens up the policy to be claimed against. Then, as we mentioned before, we're talking about the base plan now. There is, because we want to keep this as insurance, and it's very important to keep this as insurance, that any extra expenses incurred can then be claimed against the policy. And on the right-hand side, move this, hold on a second. And on the right-hand side, we clearly state up front that the claims payment should be made quickly, because in all our discussions with clients around the world, the common theme has been such that we need liquidity early so that we can ensure the business, in any kind of form, stays alive, so that we can ensure that we keep staff safe, so that we can ensure that we keep students safe, as an example in this case, so that we can ensure that the business can minimize some of the disruption. And so with that, we commit through each member signing one-page proof of loss document saying that we released up this $100,000 limit within 30 days of receiving the form. So if you liken this to other types of business interruption, BI, whether it's damage-based or non-damage-based, can often take quite a long time to crystallize the loss and to submit a claim. In our product that we're offering now, after extensive discussion, as I mentioned, not just with the market, but with Unity Mutual, it provides a quick shot of, or an injection of capital very fast. And that is something very important for us to express here, that you won't be waiting a long time to get the funds under this policy. Now, I mentioned earlier, we're going to talk about the triggers in a little bit more detail. And of course, these slides will be made available after the presentation. So this is basically a funnel and how we've selected the two triggers to use these two triggers as part of our product. So every year there's about 54, 55,000 health signals. Of these health signals coming down the funnel, 100 of these, like I mentioned earlier, become a DON, so disease outbreak news. And these DONs signify to the world community, scientific community, healthcare community, that these diseases could and are operating differently to what they have in the past. Please be aware there could be something coming down the line. Then if we look to trigger number 2 on the right-hand side, we note that this is the second trigger, and these are for FIKE level events, so public health emergency of international concern, because you may or may not know there's actually no technical definition of a pandemic. So what we use are technical definitions under the international health regulations. So we chose a FIKE as trigger 2. You can see the past FIKEs. The SARS, technically not a FIKE, but it's as a result of SARS in 2003 that this system was created. Swine flu 2009, Ebola twice in 14 and 19, Zika, and of course COVID-19 that we had recently, monkeypox in 2022, and again monkeypox in 2024. Two different variants, and Gunther will talk a little bit more about the epidemiology behind them and why monkeypox, the current strain of it, is acting very differently, more peculiar than monkeypox, the different strain in 2022. So now just wanted to provide this quick update of our civil authority restriction trigger 3. We get this question a lot. Will there be any more lockdowns? We don't believe so. There were a lot of, in Australia especially, and I went to university here, I grew up here. A lot of, I guess, clients are questioning whether it is politically, whether the government can put together more lockdowns as severe as, for example, Victoria went through. Is that possible in the current political climate or in the next outbreak? Well, I guess for us, let us shed a little bit of light on this. So will restrictions be used again is the first question. Well, if you look to the current WHO pandemic guidelines, and I'll quote here, their statement is, be ready to apply stringent public health and social measures, but for a limited period. So what does that mean? That means the lockdowns or the civil authority restrictions must be used, or should strongly is suggested to be used, but for shorter periods of time. What's called, I guess, what's called these short, sharp lockdowns are necessary because if you look at the second point, the earliest possible time for a new vaccine to be created is anywhere between 6 to 7 months. So in the interim, before the vaccines are widely available, or even available for those communities who need it more, there will need to be some way of controlling the spread. And so again, this goes back to the WHO strongly recommending short and sharp civil authority restrictions, which are enough to trigger our policy as well. So that's why we use the third. Now, will restrictions be different? I think in some way we've answered this already. They will be different, but nonetheless, they still will be present because non-pharmaceutical interventions, NPIs, or if you call them civil authority restrictions, which are the more restrictive versions of these, will clearly be needed in the early stages of a pandemic. And we can expect a lot more sort of these circuit breaker lockdowns and these short but sharp type of restrictions. So with that, this is just a summary of what I said. I didn't specifically, we didn't want to put this on this on present today about what it is. Didn't wanted to hopefully get some questions about this at the end. But when we send the slide pack out, we will certainly include this document so you can look at it a little bit more carefully. Now, just the last few slides until I turn it over to Gunther to go through some of the more topical issues the world is facing right now. This is a quick slide. I don't need to go through every single one, but it basically demonstrates how the triggers work so that we are trying as best we can to ensure that coverage is there in your time of need. This time frame is using COVID-19, and these aren't fictional dates. These are actual real dates that occurred during COVID. Now, for example, first assume the policy period of insurance is 12 months from the 1st of September 2019 to the 30th of August, or 31st of August, I should say. So the trigger number one, the dawn, as we mentioned earlier, was triggered for 5th of January 2020. The FIKE shortly followed that on the 30th of January 2020. And the first civil authority restriction in March that would have triggered this policy the third trigger was on the March 15th, 2020. So you can see between the dawn and the trigger 3, the civil authority restriction, it was not a very long period of time. Once these 3 triggers have been made, either within the period of insurance or the extended development period, which is 6 months, because we always give an additional time period to ensure that these 3 triggers will be met within the policy period, you can start submitting claims. Or you can, for example, if it's the base plan and you have extra expenses, simply need to submit those extra expenses along with proof of that you've incurred these expenses to us, and we start paying out the claim. You have a 6-month window with which to submit all your claims. Unlike traditional business interruption, where you need to crystallize your claim before you submit it, for us, you can submit it as whenever you receive or you expend those extra expenses. So we intentionally try to keep it as quick a cash flow profile for you as possible, because we know that's very important based on our discussions during Hobart and with other clients as well. So with this, I just wanted to touch on one more slide. This is more for the tailored solution, and then hand it over to Gunther. But in the tailored solution, which I mentioned before, we partner with International SOS, and it can also provide not only pre-outbreak services on the left-hand side, but it can also provide crisis response services on the right-hand side. So what do I mean by these? I won't go through these in detail, but on the left-hand side, it can help you be prepared for the next pandemic, help go through your plans that you have. There's self-service information portals where one can find out more information, for example, right now about monkeypox 2, where it is in the world, what is it affecting, or how is it affecting people, can we still travel to certain nations, and so forth. On the right-hand side, once the outbreak has occurred, what do we do? Now, of course, naturally, there will be information from the public health services, institutions in country, but often they're general, often they're just a guideline, and often people don't know how to actually operationalize what's been said. So with a dedicated global health advisor, this person can come sit with risk management, it can sit with the board, it can sit with HR, it can help tailor specific health-related questions, FAQs, and you can use this service as much or as little as possible, or as you want, and it can be supported through the funds of this insurance policy. It can also help provide a sense of ease, for people who need to go to work. It can provide you information as to, for example, they've helped a lot of tech companies in the US understand what kind of face masks, what kind of hygiene should be used, should be purchased to hopefully protect their staff and also their customers in a better way. So with that, I might just stop there. If there's any questions, of course, I can't see it right now, but we can answer it a little bit later. And I might throw it over to Gunther to give you an update about what's happening right now in regards to a few different diseases that have and that will cause a little bit of stress to the healthcare community globally. Gunther, I pass it over to you.
Thank you, Alex. Warm welcome from me as well. I'm currently on a 5-week trip to the APAC region, so very timely to be here as well, reflecting this exercise or this journey that really across the globe we now see an increased really pickup of these solutions. That is timely because a year back, 1.5 years back, you will wonder that you probably have still been in the last exercise of managing the previous COVID outbreak. So now it's really about preparing for the next one. So that we see across all different lines of business, across all different lines of industries, really recent examples of the last few weeks where clients purchased are as diverse from airport operators in Latin America, even event cancellation for weddings in Europe. Last week, we closed our first pandemic resilient loan for sovereign loans in Africa. So really just to show there's quite a range of these transactions being implemented, of these covers being implemented. And that is ultimately following the recognition that these events will occur more frequently, as sad as that is, and that hence we need to consider pandemic risk in our corporate risk management plans. There are different ways of doing that, and clearly we say insurance please should not be your only way of thinking about pandemic risk. There are different ways of managing pandemic risk. That's why also these international SOS advisory services are useful to really help you put together the right and appropriate pandemic preparedness plan for your organization, for your university. But insurance does play a certain part of it, a certain part which really should contribute to managing the next event better. And for that, we are very grateful to Uni Mutual to really put this together in such an effective way for you as the Uni Mutual members. Looking at the signs of the next one, and that's really being very concrete about how can we see what is going on. I think two are of particular relevance right now, and one is Mpox and the other one is avian influenza. So let me talk about these. We've put together this slide because you may have read from the news last week, the World Health Organization declared another public health emergency of international concern for Mpox. Typical as for many viruses, you hear about different virus variants, about clades as they call it for this one, for Mpox. So there has been one in 2022. That was a different clade, and that outbreak made it really for the first time largely out of Africa and actually reached 100 countries. So that was more on the transmissible way, even though, and that is important, and it remains also important for this clade, the primary mode of transmission is not respiratory. As such, this one we still consider overall much more manageable, just much more to be able to be controlled, even more so as the first spike declaration of 22 indeed led to increased preparation efforts so that also a vaccine is available now for Mpox. Still with not sufficient overall production capabilities, but in this combination of vaccine and outbreak, I think this one we believe can be managed and is very much declared so because A, this new virus variant is more severe cases than from the previous one, and obviously it is changing the dynamics of the spread of the outbreak. Overall, still the focus on DRC, overall still really a focus of coordination and preparation for African countries in the focus. We do see cases outside of Africa, not to be mistaken. In fact, the first case in Sweden also happened last week. And that is something which we'll continue to see as we travel globally. So there will be further import cases in other countries, but probably not the one to be of utmost concern for us in terms of global pandemic. That is important, but we do want you to treat this one really as another warning sign to get prepared. So another disease which is currently making it to the news, very strongly made it to the news in April, is avian influenza. And that is a disease which is very high up on the list of candidates for a potential new pandemic. Influenza is a respiratory disease, same as COVID-19 or SARS-CoV-2 was. It is a disease which mutates quite strongly as well. Historically, avian influenza has been a bird disease, as the name indicates. But the concerning development which avian influenza has made over the last few years is that it jumps over the species barrier and gains the capability to transmit from more and more mammal to mammal, from more and more mammal species. So it started with the minks, and the most recent one were the cows, in particular in the US, to that degree that if you buy milk in a supermarket in the US, you have quite a good chance that that milk contains avian influenza virus particles. And as many of us are infected with seasonal influenza, still the virus strain from the last pandemic, influenza pandemic in 2009, also circulating. There is not such a bad likelihood that the avian influenza virus, which currently, if you are infected, has a case fatality rate of 30%, might meet the swine flu virus, or another influenza strain, which is much less deadly but much more transmissible, and then these two viruses could mutate and combine these characteristics in an unfavorable way. So these are the scenarios of concern. Avian influenza has not spread yet, so that if it would come, would also still be covered under our policy, which you do purchase today. But also, of course, the next one may be a completely new one, a so-called disease X, same as COVID was at that point in time, same as SARS was at that point in time, a new disease jumping over from animal population to human population, a so-called emerging infectious disease. Again, we're here to help you on your way. We are help you to integrating pandemic risk into your corporate risk management plans, largely steered by Unimutual and by your input. So that's why we're very happy to have this base plan for all of you to have it integrated into your risk management landscape. Please don't stop there. Do consider what else that should be done. What is your internal corporate risk management and preparedness plan? And of course, for the ones of you who say we also need more insurance of that or more risk advisory services with international SOS, there, of course, we are here, and Unimutual and Cylinder will be of help in really putting together the tailor-made solution for your organization.
Great. Thanks very much, Günther. And that's last slide that we have to talk through today. We didn't want to labor the point too much because we're very happy to have continued conversations after this. The next, we just turn to Q&A.